is actually doing here. So you can see that Claude is leaving a trace of what it's actually doing. It's reading the research plan. It's reading how to use Amass, and then running through different steps as defined in the skill itself. So you can see that we're going through different records in DrugCore, different records in GeneCore. So here you can see the amyloid precursor protein query of that, looking up these in DrugCore by Ensembl ID or Ensembl ID, and running through different steps here. Right now we're running multiple different agents at the same time in order to then get to the outputs that we want to see. So, of course, if you run a skill like this, it may take a while for Claude to run it. So I've prepared some examples already where we've run this in the interest of time, but we can, of course, come back to this and look at the output here. But basically, this is how you can already get started using Claude and Amass together to get some of these outputs, which can be very valuable. So I have my pre-webinar workspace here. I've run a couple of different examples. So I also use the skill here for clinical evaluation. And what this basically does is it does a PICO analysis and also then the pipeline analysis for that as well. And for the different questions that we might be asking that I mentioned before about validating the target and mechanism of action in the first place, there's a pretty comprehensive research body around the amyloid beta precursor protein already. Molecular profile, clinical evidence, regulatory precedents, as well as then the competitive landscape. These are then all outputs that we expect to have. But now in Claude, what I also wanted to mention, so one of the outputs here is a briefing, which basically describes the asset itself, so trontinemab, and what happened in the trial. So, of course, we're looking at a fully human IgG1 monoclonal antibody, as mentioned, targeting the APP. Here you can see that the DrugCore carries 18 linked trials and 0 linked regulatory authorizations, as we'd expect, since it never passed phase 3. And Roche never filed BLA or MAA for it. And you can then jump over to the results, why it failed the trials, and where it got terminated. And also then, if there are some other research areas or other molecules, successors in this landscape. So you can actually see that Roche's chosen successor is trontinemab, and this is fused to an anti-transferrin receptor for greater CNS exposure, which is now enrolling in phase 3 trials. And so we can see that actually, in this case, delivery might have solved these issues. And if we look at the output, so the PICO framework, which populations were participated in the programs, the intervention method, comparator outcomes. And then for the pipeline overview, this is a very simple example of what the pipeline can look like here. So we have just a table showing the trial itself, the NCT registry ID, which is pretty important as well to make sure that we actually have the correct ones, which phase of the population is, what the trial core gives as a result. So some of these were completed, some of those were terminated, some are potentially then open, what the enrollment looks like, and then the key results from the different trials. So in the output of this report, we also output the successor asset, so potential in developing similar molecules. You can see that we list a Ensembl ID here as well. So if we wanted to, we can also dig into this and then potentially query more about the different successors. So maybe tell me more about trontinemab. And of course, usually when we prompt, we want to be a bit more specific. This was a very generic one, so Claude may just look up everything here and give you a rewording of what's here. But you can actually see that, okay, so great, it's searching BioMedCore, it is searching PatentCore as well, and now it's getting it by the exact ID that we're referencing, so we can make sure that we're actually getting the exact corresponding data from across these different cores. So now Claude is giving us an answer. It's a successor for gantenerumab. It's a bispecific fusion, as was mentioned in the report as well. And okay, perfect. Here we have the founding preclinical paper from 2023 in MABS. And that was, where did I lose it? There we go. That was a delivery of the brain shuttle amyloid beta antibody fusion trontinemab. And as Claude says, this is a direct source for the mechanism and the numbers that then are showed or are displayed as results in the preclinical paper. So 4 to 18 times greater brain exposure than gantenerumab that failed. You can see that there are 4 linked trials, and as for IP, there is a plausible lineage of patents. So there was not a direct one, but there is a one that it may be. So if we're then to research more into therapeutic fusion